Welcome to the treatment group video for the diagnostic category of somatic symptoms and related disorders. I'll be presenting on the diagnosis of malingering. My name is Dr. Brianna Triano. My client's name is Allie Dorr, and she is 26 years old. There were two differential diagnoses, the first being a factitious disorder imposed on self, and the second being malingering. Factitious disorder imposed on self was ruled out because criteria C through D were not met, and malingering was ruled in because all diagnostic criteria were met. There is only one primary diagnostic feature, that being the intentional production of physical or psychological symptoms in order to avoid military duty, work, obtaining financial compensation, evading criminal prosecution, or obtaining unneeded medicine. For Allie's story, she is a highly attractive 26-year-old female with a history of arrest for shoplifting. Her latest shoplifting incident has led to her admission to the psychiatric ward of the local hospital. Her latest shoplifting incident occurred at the local mall in a large discount retailer store. She claims to have no memory from the time that she blacked out to the time that she found herself sitting in a holding cell in the local police station. The store that Allie was stealing from had her on camera sticking many unpaid items into her purse, and they have chosen to press charges against her. When Allie emerged from her blackout, she passionately claimed to be innocent and demanded to see an attorney. Until her attorney arrived, she was very agitated, mean, and belligerent to anyone that she encountered. Once her attorney arrived, they were placed into a private interview room where she immediately calmed down. She was very cooperative, and she answered all of his questions. She indicated to her attorney that this was her third arrest for shoplifting, and the 2 times before, the charges were dropped because during these occasions she had experienced dissociative episodes in which she lost time and she blacked out, and she was deemed not accountable for her actions. Because of the success of the prior defense, her attorney petitioned for her transfer to the psychiatric unit for psychological evaluation. On her admission to the unit in the hospital, Allie settled in very well to the routine and experienced no dissociative symptoms for the first week. She was cooperative and respectful to the medical staff and other patients in the unit. She spent most of her time with a woman who is being treated for dissociative identity disorder, and she seemed to be very fascinated with her. She would ask her nonstop questions about her symptoms, her treatment, and her experiences with her disorder. However, when Allie was informed that her charges against her would not be dropped, she became very angry and agitated and profane, and she started to complain about a headache. And once the nurse tried to help her and refer to her by her name as Allie angrily yelled, "Who the F is Allie? I'm Roxy, and you better not forget it because I've had just about enough of you." Her tone and her body language were very threatening when she did this, so the nurse immediately backed off and she reported this odd behavior to the treating physician. Roxy's voice and her body language were slightly different from Allie's, and Roxy had claimed that she had been the one that did the shoplifting incident and that she stepped back so that Allie could be caught, and she added that she could have easily gotten away with it, but she wanted Allie to get caught so that she could pay for her holier-than-thou personality. Over the course of the next couple of days, Allie would go back and forth between Roxy and Allie's personality. When she was Allie, she was very sweet, cooperative, and respectful, but when she was Roxy, she was very demanding and disrespectful and threatening. Each time that she would switch back from Roxy to Allie, she would claim to have no memory of Roxy's abusive behavior, and she insisted that because she had no control over Roxy's behavior, she should not be held accountable for it. An expert on dissociative identity disorder was called in to assess the viability of Allie's claim to have an altered personality. He observed her for several days before interviewing her, and he also interviewed members of her family. Her family interviews shed light on some very important information on Allie. They indicated that they had never seen this altered personality of Roxy, and that this was news to them, and that they claimed that Allie had a very troubled past of making frequently bad decisions and then evading the consequences because various family members would step in and rescue her from these consequences. Her history of her lack of accountability appeared to be very consistent to the theme regardless of who was being interviewed. They did say that, however, Allie was a very sweet and loving person, but at the same time she could turn around and be very destructive and mean, and so almost in the sense that she was two different people. The expert also noted that during his interviews, he found no history of abuse in Allie's family, which is very typical of people who do have dissociative identity disorder. The expert then spent several hours interviewing Allie on a variety of topics. The first thing that the expert noted was that the Allie that he had observed and the Allie that her family had described were quite different. When the expert tried to hypnotize Allie, he was unsuccessful, and usually those with identity or dissociative identity disorder are easily hypnotized. He then noted that as the interview progressed, Roxy showed consistency regarding her discussion of the matters associated with the shoplifting incident and the disruptive behavior in the psychiatric ward, but her speech and her body language were not the same, which was a red flag to the expert. When he pointed out these inconsistencies to Allie, she became very defensive, and she accused the expert of being biased against her, and that he was trying to get her to slip up so that he could prove that he was right. In spite of the expert's challenges, Allie insisted that she had amnesia through the shoplifting experience and the abusive behavior, and did so in a similarly aggressive manner to the tone of Roxy's manner and tone. Allie tried over the next couple hours to convince the expert that she had dissociative identity disorder, but after everything that she had said and everything that she had, all her symptoms, she finally gave up to the charade and admitted that she had been making it up the whole time. For the multi-axial diagnosis, axis 1, malingering, axis 2, none, axis 3, none, axis 4, arrested for shoplifting, and axis 5, the GAF equals 64. For theoretical perspectives, there were two. The behavioral perspective, the client's behaviors may be due to a faulty learning experience. The faulty learning experience is operant conditioning. The client learned through her previous shoplifting incidents that she would not be held accountable for her actions if she appears to have a mental disorder. The client's pretending to have a mental illness and getting away with the previous shoplifting incidents is negatively reinforced. The second perspective being social cultural, the medical and judicial systems have enabled this client's behavior. The client has faked her psychological symptoms before and has been successful at it. Having been successful at faking her psychological symptoms before, she was enabled and knows that she can get away with it. Thank you.